I love working on interoperability purely because it's interesting, it's a big problem, and I just at heart have always viewed myself as a problem solver. And I love healthcare because there's no more important problems to be solving than taking care of our fellow Americans and leaving hopefully a better system for generations to come. I've always found it interesting at different events and different viewpoints around interoperability when, well, what's the piece of legislation? What's the thing we have to mandate? What do we need to require or certify so that we're done talking about this? And I find it such an interesting viewpoint because we're never going to be done. We will make progress along the way. We will have a journey, but we will always be refining, improving, evolving what we're doing in the interoperability space. And so I view interoperability as never done. We just continue to improve and continue to refine how we're doing it, what we're doing with it, and what value we're providing. So in the future of interoperability, I see two massive outcomes. Of course, we're going to have more efficient care. Of course, we will have lower cost care that's safer and higher quality. But I also think about two really specific dimensions. One, the patient experience is fundamentally different in their 7 minutes with their physician. The physician is looking eye to eye with the patient. They're not spending as much time looking at the EHR because the data is so liquid, the actionable intelligence was so well thought out and delivered that the majority of the visit is spent human to human. The second is around not the humans at all, but the data and the analytics and AI that is happening in the background, because high volumes of high quality data are made available so that systems and analytics can do things that the humans can't do. So those are the two dimensions that I think about in terms of, like, have we made a dent? Are we there yet? What does it look like in 10 years?